and welcome to the Art of Being Human. I don't know if you remember this, but on the last segment I talked about insulin, I talked about Lantus, and I just want to, before we get going on anything else, tell you a little bit more about Lantus, which is a long-term insulin, a long-lasting insulin. And I remember telling you that the patent had run out, and so that people were going to come in, different companies were going to come in and try to take and make something like Lantus, because Lantus is a very, very effective long-acting insulin. As a matter of fact, there are a lot of patients, diabetic patients, that take Lantus and nothing else, and they do really well. And usually they take it once a day, but sometimes people split it into 2 doses because they get better coverage that way. And I remember telling you that Lantus patent had run out, so new people were going to come along and make a new form of Lantus. Well, Lantus decided to make a new form of itself because it wants to be at the top of the heap like it is with the Lantus now. And so it invented a new kind of Lantus, and it's called Toujeo. And it's spelled this way, Toujeo, spelled Toujeo. It's pronounced Toujeo. And it's supposed to be that you can take 1 shot and it lasts for 24 hours. But it does have one little minor side effect, which gives me pause. I don't see how they dare to give it out. Its side effect is this: it gives you heart failure. Now, there's no saying who's going to get the heart failure, and it doesn't matter whether you have a history of heart problems or if you don't have a history of heart problems. Anybody who takes that new drug, that new type of insulin, Toujeo, can get heart failure, and you just can't predict who's going to get it. Now, I can't believe anybody would take the risk of it, but they sell it. It's brand new. It's just out on the market now. I've seen advertisements for it, and they keep saying can cause heart failure, can cause heart failure, and they do make an issue of it when they advertise it, but I can't imagine anyone taking it. I have no objection to taking an insulin, long-lasting insulin, twice a day. What's the big deal? I take 5 shots a day anyway, so what's the big deal if I take an extra shot? I'd rather do that than have such a long-lasting insulin that I don't know if my heart's going to fail or not. My heart's already failed sometimes. So therefore, I don't want to take the risk of anything else. And if I didn't have heart problems, I wouldn't want to take the risk of possibly having it. It might be a difference if you knew who was going to get it. What is a profile of people that would get heart failure, as opposed to the profile of people who don't get heart failure? There's no way of knowing with this drug. It may be that it is so new and the research on it is so new that it's going to require time, usually years, before they know fully what the side effects are. And that's not unusual in new medications. They do the best they can. They do all the research they can. They don't put it out until they think it's safe. They do have side effects. They have a list of side effects. But when they mention heart failure, that's too big of a risk to take, at least for me. So I want to tell you about that. And then I'm just going to put this over here. There are a couple of drugs I want you to know about. I have gone into different types of drugs. And I'm not talking about prescription drugs. I'm talking about drugs that kids take. And there are 2 new ones that I have come across, and I just want to mention it to you in case you're a parent and you're watching this. And they're in the form of teas. One of them is Kava. And you hear about Kava every so often, but it causes liver failure, hepatitis, cirrhosis of the liver, and it causes kidney damage. It also damages the skin, and it damages the lungs. So you could knock that off the list of anything you would want your kids to take. The other one is kratom tea, and I'd never heard of it, but I know about it now. It causes respiratory failure, damage to internal organs, multiple organ system failure, psychosis, hallucinations, mood swings, insomnia. So that's another drug that kids are taking in the form of tea that's really bad for them. And you can also get nicotine by itself, not in terms of smoking, but in terms of yourself, of using it by itself. And the danger of that is that 1 teaspoon of it equals 128 cups of coffee. So that's a lot of nicotine in 1 teaspoon, and sometimes it causes death, and if it doesn't cause death, it causes heart trouble. So these are things you need to be aware of. Once in a while, I'll go back to something that I have talked about before to keep you up to date, because if you're watching and you obviously would have an interest in your health or you wouldn't be watching, and I think it behooves me to keep you up to date. Now we're going into blood pressure. What is it and what's the danger of it? If you have high blood pressure, you can't be in danger because it can cause you to have a stroke. It can cause heart failure. It can cause damage to your blood vessels. So I want to get into that. Blood pressure, by definition, is the pressure of the blood against the walls, the inner walls of the blood vessels, as it flows through the body. So pressure within the blood vessels, as it's flowing through the body, that's what blood pressure is. And it varies in different parts of the body. You can have both high blood pressure or low blood pressure or normal blood pressure. High blood pressure is what most people suffer from if they're going to have a problem, and that's called hypertension. 60% of people with type 2 diabetes have high blood pressure. And if you have it and you're type 1, then you probably already have kidney disease. That's just kind of a thing to think about. Type 1 and you have high blood pressure, your kidneys are in trouble. Type 2, you have high blood pressure. 60% of people with type 2 diabetes do have it, but it is dangerous, and it is something that you have to watch. I know my doctor has now had me take a list of all my blood pressures when I go into any doctor, to see any doctor for any reason. He wants to know the blood pressure, and I keep it for him in a chart, which I give him every so often. And I finally said, when do you want me to stop doing this? And he looked at me like, you mean you want to stop? I says, do I need to continue? He says, the purpose of your doing this for me is the fact that I don't want to get panicked when I see you have a high blood pressure. I would go into a state of panic if it was too high. Fortunately, I do have some high blood pressure. I never used to, but I think it's a product of age. It can be a product of diabetes. But at any rate, if it goes too high for any length of time, you are in danger of having a stroke. And that's the important part. With high blood pressure, your heart works harder. It's harder for your heart to pump. I know I had a doctor once who put me in under anesthesia for eye surgery, something which is rarely done. And when he retired and I went to a new doctor, they were astonished that he would ever do that. In fact, they said it was a mistake and he shouldn't have done that. And I said, well, what's the problem? He told me he needed to do that because I had heart trouble. And they rolled their eyes and said, that's the worst reason to do it. Because when you're under anesthesia, it's hard for your body to function. You are anesthetizing and you are depressing the organ system. So the organ systems can't do as well what they usually do if they're not under anesthesia. It is harder for the heart to pump. It has to work harder to get the blood going when you're under anesthesia because the heart has been depressed along with all the other organs of the body. Now, if your heart is compromised anyway, and you're having heart problems anyway, to make it harder for the heart to work is putting you at considerable risk. So they basically told me this doctor was not right. He didn't do the right thing. They're horrified by it, but at any rate, he has since retired. And I made out well, but it was fortunate that I did. Now, the heart works harder. It damages, the high blood pressure damages the lining of the arteries, and you have fatty tissue which is formed. This is called atherome, and it completely blocks an artery, and so therefore you can have a blockage of an artery which can lead to stroke. It also damages small blood vessels in the eyes and in the kidneys, and it has no symptoms, and that's one of the things that makes blood pressure dangerous, high blood pressure, hypertension. It's dangerous because you don't have symptoms of it. You don't feel a pain. You don't feel the pressure. You feel all right, but meanwhile the heart is pumping harder, the blood vessels are being damaged. You don't feel that. One of the problems with diabetes anyway, with the high blood sugar, is the fact that you don't feel what's going on in the system. You can have eye failure, you can stop to go blind. You don't feel it. There's no symptoms to it. And if you had symptoms, you'd check it out. You go to the doctor, I have this pain, or this is happening, or that is happening, and they would know for sure. So they have to check you every so often. And even though you're not feeling something that's going on in your system, it doesn't mean that something's not going on in your system. So it damages the blood vessels and the eyes and the kidneys, and it has no symptoms. And it does add the cardiac problems. Now you have two types of blood pressure that are measured, and one is systolic and the other is diastolic. So systolic is the pressure during the contraction of the heart, when the heart is actually working. And diastolic is just the opposite, is when the heart is relaxing. You know, when you're working with muscles and you're doing exercising or whatever it is you're doing, or walking, you use your muscles, and the muscles require an equal amount of rest as the exertion that you gave it. So supposing you're hammering a nail and you're using your arm muscles, at some point you have to give the arm muscles the same amount of rest as you did when you were hammering in the nails. Well, when does the heart rest? The heart can't stop. If I'm walking, I can stop and sit down and rest. If I'm pushing something, I can stop and give myself a break, and the muscles will relax, and then I can begin again if I want to. The heart can never stop. It's always got to be pumping. It's always got to be working. So when does the heart rest? Well, it rests between beats. So when you have your blood pressure taken, they take two blood pressures. They take it when the heart is contracting, and then the heart relaxes. That's where it's getting its rest between beats, and it takes the blood pressure there too. So you have your diastolic and you have your systolic, and the systolic is on top and the diastolic is on the bottom. So let's take a look at some charts here, and I'll just go along here. The pressure of the blood pressure is the pressure of the blood against the arterial walls while flowing. Hypertension is high blood pressure. Systolic pressure, that's how you spell it, systolic, is pressure when the heart is contracting, and diastolic is pressure when the heart is relaxing. So you get a systolic and diastolic reading. Like, for example, this is ideal, this is good. 120 over 80, perfectly optimal, good good blood pressure. Then when you 120 over 80, then normal, which is not optimal but close to it, 130 over 85. So it would be 130 systolic over 85 diastolic. Now you start to get high blood pressure if you get readings 130 to 139 as your systolic, and 85 to 89 as your diastolic, then you're starting to get blood pressure problems, high blood pressure problems. There are three stages to high blood pressure, three stages to hypertension. The first stage, the range of the blood pressure is going to be 150 to 159 systolic over 90 to 99 diastolic. That's the first stage of blood pressure problems. The second stage is 160 to 179 systolic to 100 to 109 diastolic. And the third stage is going to be 180 or more to 110 or more. This is practically stroke level. And so those are the three stages. I had never, until I started doing research on this, I'd never thought of it as being in stages, but it is in stages. And those are the three stages. Now, and this is pretty much what I've already talked about. Blood pressure, the systolic is when the pressure of the heart, when the heart is pumping, when it's working, and that's the top number. The diastolic is the pressure between the beats when the heart is resting, and the 120 over 80 is considered to be optimal blood pressure. Let's see. Now, here are some numbers. of what you should have, or what if you're in good health, this is what you're going to have. This sign here with a little caret toward the left, it means less than. And the little caret to the right means more than. The best numbers for blood chemistry, and this isn't just blood pressure, it's blood chemistry. The blood pressure, highest, the best, optimal will be 120/80. Your fasting blood sugar should be less than 100. Your total cholesterol should be less than 200, but it differs for heart patients. For heart patients, they want your total cholesterol down to 70. And that's where mine usually is, 73 or 74. But with the help of statin drugs, most people can't do that on their own because you would have to have such careful management. And you have to remember with cholesterol, you make most of it your own. Your body makes most of your own cholesterol. So people say, well, you know, diet helps, exercise helps. There's a lot of things that help. But even if you're doing all the things right, you can still have high cholesterol. And that's because your own body is making most of its own cholesterol. HDL stands for good cholesterol. And the good cholesterol needs to be greater than 60. LDL is the bad cholesterol, and that needs to be less than 100. Now, if you have the good cholesterol, if it's higher than 60, if you have a good number for good cholesterol, it will help to drive down the bad cholesterol and actually help to get rid of it. So having good cholesterol is important. The waist size, men's waist size should be less than 40 inches. Women's waist size should be less than 35. If you have greater than 35 and you're a female, it's harder for you to metabolize medication. One of the things that happens if you're taking insulin, and most of us do, is the fact that if you are actually injecting insulin in your abdomen and you have excess weight on your abdomen, which most people do once they get to middle age, they kind of sprout there. That makes it harder for medication to get into the bloodstream to metabolize, and that can be a problem. So this is kind of a review. The artery pressure between the heartbeats is when the ventricles work, and that's when you get your systolic blood pressure. Now, how much more do I want to talk about that? The pressure, if they take your blood pressure, it's transmitted through the arteries with each beat, and it is felt as the pulse. You feel the blood pressure as the pulse when it's going through the heart, and you get that beating. You get the regular throbbing of the arteries by the contraction of the ventricles, and the blood pressure might be read as 120/80. The higher the blood pressure, the worse that it is going to be for your health. Now, a lot of things will affect the blood pressure. Salt raises it. You have to be very careful, and there are some people who are diabetic that cannot have salt at all. And if you have a complication with your kidneys, you cannot have salt at all. In many cases, I had a friend of mine, she's passed on recently, but she was not allowed to have any salt. Well, salt's in everything. So what can you end up by eating? Well, fresh vegetables, you know, maybe some soups. There is a product called Herb Ox. It's a chicken bouillon. It has absolutely no salt in it. It tastes a little bland. You know, salt tastes good, at least a little bit of it. If you have tension, that will also raise your blood pressure. Fear will raise your blood pressure. And that can be reduced by diet, exercise, and medication. Some people don't have any salt or can't have any salt, and blood pressure can indicate blockages. If you go to a doctor and you have some heart problems, they will take your blood pressure on both sides. You know, the cuff, they put the cuff on one side and they squeeze it tight. They squeeze it tight enough that they actually stop the blood flow. And then they make it less and less, and they allow a little more blood and a little more blood to flow through, and it gets more and more as they release it. You can feel that as that cuff is being released, but when they first put the cuff on, they actually squeeze it so tight that the blood flow stops. And it's uncomfortable. It's tight enough to be uncomfortable, and gradually they release it, and a little more blood is allowed in, and a little more blood flows. That's how it works. But some people, as a result of high blood pressure, can't have any salt, and they have a restricted diet. When they do the blood pressure cuff on one side and get that number, they'll turn around, if you're a heart patient, and put it on the other side. The same thing, squeeze it tight so that the blood flow stops, and the same releasing. And they get the blood pressures for both sides, both arms. Now, there's a reason for doing that. If there's a discrepancy and there's a big difference between one arm and the other arm in terms of what the blood pressure results are, it's probably because there's an artery that's blocked, and that's how they can check for it. They may not know exactly where the blockage is. You might have to have some kind of a test or a scan or an ultrasound to be able to discover that, or an angiogram to discover that. But there will be a blockage somewhere. If there's just a few points within a certain range of difference, then you're fine. There's no blockages. So that's one way that they discover whether you have a blockage in your arteries, whether you're going to need to have bypass surgery or some kind of a stent surgery. That's one way of checking it. Check the blood pressure in both arms and see what the discrepancy is between the numbers. A lot of discrepancy, you've got a definite blockage problem. No discrepancy, or just within a certain range, not a lot, then you're okay. Well, I'm going to close it here. We're just about out of time. In the next segment that we have, I'm going to start talking to you about what people find helps them when they have diabetes. Some of this is folklore, some of this is actual fact, and I just want you to see what people have used through the years to help them in their diabetic journey. So that should be kind of a fun one. So we'll close it here. Please join me next time.